Alrighty, so our case is Mrs. Smith. She's a difficult intubation. Patient has been off the vent, but she has a copious amount of secretions. Please change trach per routine trach change policy and suction PRN. Patient is on a 40% trach collar and SATs are 98%. Can Miss Smith be weaned and decannulated? Why or why not? How would you wean her, or what are your suggestions? So at this point, I don't feel comfortable doing any kind of weaning or decannulation because she already has a history of being a difficult airway. And I would go ahead and suggest a mucolytic for the copious amount of secretions to kind of help get all of that gunk out. Now at that point, we have an order and we've already confirmed the order. We're going to check the chart for any contraindications or allergies that we should be aware of, which there are none in this case. So we're going to go ahead and gather our equipment, which includes the suction kit, the sterile field. We have our ambu bag. We've got the Yunker catheter. We've got the strap, gauze dressing, and of course our stethoscope and pulse ox. We're going to go ahead, wash our hands and glove up before we enter the room.
I will be the assistant today.
She's my lovely assistant. Couldn't do anything without her. All right, so once we've washed our hands, gloved up, and have everything ready, we're going to enter the room and introduce ourselves to the patient, get our 2 patient identifiers, make sure we're in the right room, doing the right thing to the right person. I would go ahead and explain what we're doing, list any kind of complications and what we're doing to mitigate them. So for example, hypoxemia is the most common hazard of suctioning, but to mitigate that, we're going to pre-oxygenate before and after. I would go ahead and get consent for the procedure, and then we can go ahead and do what we need to do. So knock knock. Hi, Mrs. Smith. I'm Dion with respiratory, and this is Chandrika. She's my assistant today. We have orders to change your trach tube out. Is that all right? She says yes. I go ahead and get her first, last name, and her date of birth. We've got the right patient. So at that point, we're gonna go ahead and set up the sterile field. I'm gonna go ahead and pretend like I'm setting it up, even though it's already set up. Make sure that I'm not actually touching the gloves when I open it up. Make sure I'm not touching any of the things when they come out of the pack so that they remain sterile. And then get my trach tube out, open that up without actually touching the tube just yet so that that also remains sterile.
And while she's doing that, I'm going to go ahead and set up our ambu bag. We're going to set it at 15 liters to make sure that the bag is fully inflated. I will go ahead and turn on my suction. It's going to be anywhere between negative 120 to negative 150 right now for this procedure. We're going to start it at negative 120.
And at that point, I would go ahead and connect my suction with my sterile hand. I only have one sterile hand and one dirty hand, so it makes a lot of this a little bit easier for me.
I'm also going to go ahead and get my gauze together. We don't have, disclaimer, regular gauze to clean it. So for the purpose of this video, I will be reusing the same gauze. Okay, we would never do that in real practice. Go ahead, Dee.
Okay, so I also forgot to do my pre-vitals, but of course I would do that before setting up the sterile field, because if I did it this way, I would have to throw away my sterile glove and then restart. But we would go ahead and do breath sounds, which would confirm the need for suction because she's very rhoncorous. We would go ahead and put a pulse ox on her if she doesn't have some kind of monitor to get SATs for the pre-oxygenation, and to also get heart rate just in case she goes tachycardic on us when we suction, which can happen. So we've got her pre-vitals. I have set up my sterile field. I have connected my suction, put one sterile hand or glove on for this sterile field. I'm gonna go ahead and put the water into my cup. I'm going to put lube on the suction catheter. At that point, I am also grabbing my tube and my obturator, and I'm making sure that I'm only touching the part that goes outside of the patient with the dirty hand, because I don't want to touch anything else. Now I can touch the inside with the sterile one. So I'm gonna go ahead and click the obturator in place. Make sure that I can put it in and out. And then once that's there, I'll put it in. Yeah, this one. Yeah. I don't think we have the obturator for this one. Because this is the obturator for that one.
Do you not have the other obturator?
No.
Can you pause your video?
Yeah, hold on. Cut!